Alright, hi guys. So my name is Joanna and I'll be talking about multiple myeloma. Patient presentation. A 60-year-old male has been complaining to his doctor that he's been experiencing back pain and has been feeling very exhausted. He's also had a fever off and on for the last several weeks. His doctor did a blood count and came back with 9 grams per deciliter of hemoglobin. The doctor also took a blood sample and it showed to have an elevated creatine level. The doctor ordered a pain lumbosacral x-ray for his back pain. has not yet been established, but there's some variety of factors. There's genetic, environment, or occupational causes, and then MGUS or MGUS, radiation, chronic inflammation, and infection. As for genetic causes, multiple myeloma has been reported in 2 or more first-degree relatives and in identical twins, but there's no evidence that suggests a hereditary basis for this disease. And then as for environment or occupational causes, individuals with significant occupational exposures in the agriculture, food, and chemicals. And then on the right side, you'll see a lateral radiograph of the lumbar spine. This image shows a deformity of the L4 vertebral body that resulted from a plasmacytoma. Alright, some background. So, multiple myeloma accounts for approximately 1 to 2% of all cancers and slightly more than 17% of hematologic malignancies in the United States. It's a disease of older adults. The median age is 66 years old, so 2 to 10% of patients are younger than 50 and 40 years old. The American Cancer Society estimates that in the United States, approximately 32,270 new cases of multiple myeloma and 17,530 in men and 14,740 in women, and approximately 12,830 deaths occurred from multiple myeloma, and then 7,000 of those in men, and then 5,000 of those in women. Some risk factors, so older age, so around 60 and over, are more at risk at receiving this type of cancer. Men are highly more affected than women. So some hormonal factors, so it may play a big role since women have lower age-specific prevalence rates when compared to men. And then just exposure to radiation, benzene, and other organic solvents. The number of cases reported due to these factors are actually pretty small. Alright, so the pathophysiology. So our bone marrow produces blood cells, so it's red blood cells, platelets, and plasma cells. The development of so monoclonal gammopathy of undetermined significance, or in shorter words, MGUS. So their plasma cells usually produce antibodies that help our bodies to fight infection, but instead of doing that, it's actually producing M proteins. So skeletal processes. So there's many processes that go along with this, so bear with me. So due to the cancerous plasma cells building up on the bone marrow, it creates damage to the bone. So we see skeletal destruction with osteolytic lesions, anemia, and hypercalcemia. And hypercalcemia, which means high calcium levels. So that actually results from bone pain, osteoporosis, and fractures. So the bone is constantly being destroyed due to the substitution of the tumor, which leads to pain, spinal cord compression, and pathologic fractures. Neurologic processes, it's a complication of We see radiculopathy, which is also referred to as a pinched nerve. What that means is a nerve is affected and might not work properly. Results from the compression of the nerve by plasmacytoma, which means a tumor consisting of abnormal plasma cells. As for a general process, we see a hyperviscosity syndrome that results from the abnormal plasma components What that does, it increases in blood viscosity due to the increase in circulating serum of immunoglobulins. And as for renal processes, multiple myeloma produce large amounts of monoclonal free light chains. So these light chains are filtered across the glomerulus and reabsorbed by the proximal tubular cells. However, a large capacity of the reabsorption can be exceeded due to the light chain overproduction in multiple myeloma. So these plasma cells produce light chains that are either excreted or catabolized by the kidney. So due to the overproduction, it overwhelms the kidney ability to do its job, and some of the proteins get stuck in the kidney. So that's something that we don't want. For symptoms, we see bone pain, recurrent infections such as fevers, renal failure, anemia, fatigue, and pathologic fractures. So for bone pain, multiple myeloma causes these soft spots in the bone called osteolytic lesions. They appear in an X-ray. So these lesions are painful and can actually increase the risk of painful breaks or fractures. But then we also see that the myeloma can also cause nerve damage or pain when a tumor is pressed up against a nerve. The tumor compresses the spinal cord, which can actually cause the back pain and muscle weakness. For renal failure, kind of like I mentioned before, it's the overproduction of light chains. And for anemia, we see the decrease in production of red blood cells from the bone marrow. Diagnosis. So bone marrow aspiration or biopsy. So what they'll do is on the back of the pelvic bone is numbed with local anesthetic. A needle is inserted into the bone and a syringe is used to remove a small amount of liquid from there. For the biopsy, a needle is used to remove a tiny splinter of bone marrow. The bone marrow tissue is examined in the lab to see the appearance, size, shape of these cells, how these cells are arranged, and to determine if there are any myeloma cells in the bone marrow. They'll do an MRI detecting thoracic and lumbar spine lesions, radiography, evaluation of those skeletal lesions, and then what they also might do is a 24-hour urine sample. So what this does, it helps diagnose kidney problems. It is often done to see how much creatinine clears through the kidney. As I mentioned in the beginning, the patient had an elevated creatinine level, so you'll see that as well. They might perform other two tests, urine protein electrophoresis, and that just checks the levels of proteins in the urine, and a Benz-Jones test, that is specifically tests for light chains proteins in the urine. And then they'll do a complete blood count. So that test just measures the levels of red cells, white cells, and platelets in the blood. There are too many myeloma cells in the bone marrow. These blood cells levels can be really low, but the most common finding is low red blood cell count. And for treatment, so one of them can be a bone marrow transplant, radiation therapy, some pain medications, which is due to the bone pain, and medications such as bisphosphonates to help prevent bone loss. Here are my references, and thank you for taking this time to listen to my video.